Hey, it's me, Daisy. Welcome. Come on. Let's go.
Watching reruns of the same shows. Almost everybody on the night.
So this is the room that they have you staying in. At least it's an actual room. The last time I was here, I was in a hallway on a bed.
That was helpful.
You know, not too bad. It's whatever. It's to keep people safe from harming themselves and others. This is the bathroom. Same type of deal. Definitely like jail cell type of vibes. Not gonna lie.
Is the fact that you literally have to either hurt yourself or hurt someone else in order to get like proper help. So I'm about to leave. It's like 2:08 in the morning. The doctor said he doesn't believe I'm a harm to myself or anybody else. So I'm okay to leave now. So I asked him about the clinic. I said, okay, well, how can I get in touch with the clinic again? And he said, basically, well, you missed the appointment. What happened was they sent me a piece of mail. They didn't send me an email. They didn't contact me by phone, not that I know of, or anything. Didn't contact my emergency contact. Didn't contact my husband or anything, not that I know of. And if it's a mental health issue, and if it's a fact of being a danger to yourself or anyone else, don't you think you would do what it takes to get in touch with the person so that they can get the help that they need? No, not really. Not with this healthcare system, right? So I got my mail late because my landlord didn't give me my piece of mail until the day before the cutoff date for me to connect with the clinic. I forgot about it because I only got the piece of mail a day before, and I totally forgot to just give them a call. And he said, well, you missed your appointment, so we can't refer you again. So you have to go. So instead of keeping me here to be seen by their clinical staff, their clinical team, I'm going to be sent home. So if anything happens, what? Then again, it becomes my fault. Even though I've been here, this is my second time coming here. This is a trend with Peel and Branton. They're just so lackadaisical in helping people who take their time to be proactive. He told me to wait on my family doctor again. I've been talking to my doctor for how many years? Seems like I need a new doctor because they're not quick with it. They're so slow, and they basically just want you to do something, either to someone or yourself, that puts you in a position to get in trouble. Because when you come to them, they're not competent enough to give you the help that you need. I don't care how many times I come here. If I need the help and I'm trying to be proactive so that I don't hurt anyone or I don't hurt myself, give me the help. Why do you work here? Do you work here to help people? Or do you work here just for your bank account, sir? It's completely asinine that I have to be completely out of my mind to get help. I do not think that is right. I don't think that's fair. I think that's wrong, and it puts people in a position of crisis, to go into crisis. What are you a doctor for? What are you a nurse for? Do I have to be screaming and angry and hurting people in order to get help? Is that what I have to do? I don't think that's fair, and I don't think that's right. Do your jobs. Thank you for your help. Do better. That's why you were trained. That's why you went to school. To do better. To help people. That's why you went to school. Not to be complete beep and not use the education that you were given to actually do something with. I know it's hard for you to understand someone struggling and coming and asking for help instead of being brought in here, officer, or in an ambulance. I don't think it should take that. Do better. Like people think about the free healthcare that we have here. What a joke. I'm sorry. It's a joke. It's a joke. I shouldn't have to go into crisis. I shouldn't have to hurt myself or hurt someone else to get help. What did you go to school for? Ask yourself that question. What did you go to school for? And again, I'm going to go into my chart. I'm going to find the doctor's name, and I'm going to say it publicly now because I don't care. Enough is enough. Because if anything is to happen, it's going to be on me. As I said, I'm willing to do whatever it takes to get the help that I need. Mine is hurting someone or hurting myself. I don't think it should take that. That's crazy. That's an insane type of way to think. Just because somebody can compose themselves and speak and articulate themselves doesn't mean they don't need help. It means they're smart and proactive and productive. You should try it. I think it's so crazy when people say that Ontario's healthcare system is like 5 stars. I think it's crazy. This hasn't been the first time when I've come to Credit Valley specifically to get help. Let me tell you about the first time. The first time was when I was pregnant with my 3rd child. And I came into labor and delivery, and I know my body because I'm not stupid. Yeah, I know my body, and I knew I was in labor. And instead of helping me, the competent staff who went to school for years to become nurses and doctors used their education and their educated and intellectual minds to say that I wasn't in labor. So they sent me home to Milton. So I went home. Then, in the middle of the night, I don't know how fast I went from, they sent me home at 3 centimeters. I think they sent me home at 3 centimeters. The smart staff sent me home at 3 centimeters. I think I was maybe about 15 minutes apart, contractions. So I went home and I got up in a rush. I had a shower because I'm like, okay, it's getting painful now. I have a high tolerance for pain. I'm not a little, I have a high tolerance for pain in every facet of our human experience. I have a high tolerance for pain. So I went into labor. Well, I was in active labor. I had a shower, and it went from 15 minutes or 10 minutes apart to like 3 minutes apart in like, I don't even know. It wasn't very long though. And I said, okay, I gotta go now. We went to the hospital, and I almost had my daughter in the parking lot. If I wasn't smart enough to say, you know what, I'm not gonna make it to Credit Valley, I'm gonna end up having my child in the car, we would have had a baby on the road. And after that experience, and then when I went into Milton Hospital, the smart, educated, yet so clueless staff said I wasn't in labor. Just because I have such a high pain tolerance. I'm sorry that you're but I have a high pain tolerance. So I was crowning in front of the hospital. My child could have been born on the cement. If it wasn't for my mom being there to help me, get me in a wheelchair. As I'm sitting in the wheelchair, my child's head is coming out of my cervix because the competent staff decided to send me home and say I'm not in active labor, putting not only my life in danger, but my unborn child's life in danger. And they're competent, and they're educated. The lady didn't believe that I was in labor when I was crowning. You think I'm stupid? You think I'm dumb? You think I need to have years of education to know my body? Or to use my brain? Or to use common sense and maybe just check? You think it takes years of education for that? All it does is take a little bit of maturity and life experience.
Quick break here. Now that I realize it, the intake nurse at labor and delivery in Milton asked me if my water had broken. And I had never experienced my water break, so I didn't believe my water did break. And I'm realizing my water probably broke in the shower. So I didn't realize a gush of fluid come out. And so maybe that's why I went from, I guess, what was it? Totally forget, 15 to 3 minutes in the shower.
So what she ends up doing, I said to her, okay, I said to my mom, I feel like I need to push. I'm like, I feel like I need to push. And she's like, okay, you know what? Let me get her into her room. Let me check. So she moseys on over with her slow self, gets me into her room and says, oh my God, the baby's head's right there. Duh. That's what we were trying to tell you. You're smart? You went to school for what? Sorry? What did you go to school for? Put my life in danger, my child's life in danger? Did you even apologize? I don't think so. I don't think you could find it within I don't think your education taught you to be an integrity-filled person with character, forethought, afterthought, care and thought for people. Your education didn't even tell you to maybe apologize, because you just put my life in danger again. So after that, I had home births. The midwife. I didn't leave my bed because I'm not stupid. I learned from my mistakes. And I learned that I can't trust the healthcare system the way I'd like to. That at any time, it's your fault when you're going to them who are educated and paid to be the help, but they refuse to be competent enough. They refuse to educate themselves past their book and theoretical education. And I'm sick and tired of it. I really am. I'm so sick and tired of it. Like, what do you go to school for? You go to school for nothing. You go to school to get a piece of paper. That's what you do. You go to school to build your ego and not actually help people to the best of your ability. You don't actually put them, their care, their health above your own. And I think that's really unfortunate because you put people's lives in danger. After the lady checked, she said, oh, the baby's coming. Like, do you need help? You probably do need a little help. You probably need to check yourself in to the mental ward because we told you that. Why are you so slow? Like, I'm tired of dealing with people who think that because they have a piece of paper, they have a career, they have a house, they've gotten their kids to, a certain place or whatever. So they just feel like, oh, great, life is made. I'm good. I can coast. I got it. Do better. Do better. Do better. I refuse to let people who have a certificate behind their name but no real world, real life experience enough to know when somebody is in need of help. It cheeses me so much. It upsets me greatly. It frustrates me to the point of no return, that you can't find any good help. And if you want good help, you have to have those resources in order to get the help that you want. Even in Canada, even in Ontario, Canada. Why is it taking me 10, 11 years to get a simple diagnosis? Can you tell me why? I may not be a doctor, I may not be a nurse, but I'm not stupid. I'm not stupid. I think I have a lot more of the ability to deal with people, and just based on my level of human compassion and care for people outside of my own self, that helps me to be, I guess, more intellectually put together. And I think that it confuses the nurses and it confuses the doctors that somebody could be so cute, so well put together, so well spoken, but still need some help. I think it confuses them. I think they're so confused. When the nurse saw me crowning on the wheelchair after Credit Valley sent me home, she must have looked at me like I was a little girl, like I was stupid and dumb and didn't know my body and how the human body works. Listen, woman, it wasn't my first time around. It wasn't my first rodeo. But because of you, I learned, and I said, you know what? Midwives, home births after that. And my last births have been the most blissful births I've ever had. No pain medication, no hospital staff, no nothing. Not to knock the ones that helped me when I was here, because they were great. Dr. Gerland, great. I will review that man positively for the rest of my life. Competent doctor, professional, yet caring, yet serious. Love it. Like a very, very good example. And the two lady doctors that were supposed to be my obstetricians. Great people. But when it comes to mental health, it is so different because, well, it's not really. Because you could see I was fully pregnant. You knew I was 39 weeks pregnant, or 40 weeks pregnant, or 41 weeks pregnant. You knew that. You could tell by my body. You could tell by my chart, my medical chart, where I was, how far along I was in my pregnancy. You could tell physically. But even then, the doctors and the nurses were so confused. Oh, we're so confused. We're so confused. You're not giving birth. You're not in labor. No, why are you rushing? She's not in labor. Puts her hand in my crotch, says, oh, the baby's head's there. I am done with medical professionals not doing their jobs. I am done with it. I am so done with it. Why would you waste the time in years and years of school to be unhelpful to someone who is coming to you for help? Not only once, not only twice, but a third time. And then when something happens, when something goes wrong, you then negate all the responsibility and put it back on the person, instead of your competent, educated professionals who somehow let one slip through the cracks. Do better. Like you of all people, do better. You have the resources to do better. If you need the help personally, if you need the help mentally, emotionally, physically, you can get it because you have the resources. Unless you mismanage them, and you'd probably have to see a doctor for that. You probably have to look into that. You probably have to use your critical thinking skills and look into that and ask yourself, well, how can I be such an accomplished doctor but still be struggling in areas of my life that I should not be struggling in, or I should have a little bit more self-discipline in? You should probably get that checked out. You should probably reach out to a work colleague, and ask them to check you out so you can get help. so that you can continue to be the best healthcare professional that you should be. What did you go to school for? How are you so educated? You can't even do the simplest thing is to be introspective. To think, oh, let me think about what I'm doing here. Let me do a little bit more investigating. Like, why is she back here? You think I'm back here because I want to waste your time? No, I'm back here because I'm sick and tired of being sick and tired of and not getting the help that I need. So I guess I have to be a squeaky wheel, and I'm okay with that. Not only in the past 5 months have I been to a hospital in the region and been turned away from the very, very easy help that I could have been given. Put my life in danger. If I wasn't smart enough to say, you know what? Something's not right here. I need to see someone immediately. That could have been the end of me. And guess who would be sitting there in their office, going home to their families? The doctors and the nurses who didn't listen to me, who didn't help me, who didn't take me seriously. Not the first time, not the second time, not the third time. It took the third time of me going there. And you guys still couldn't even use your brains. Different doctors, different skill sets, even a female doctor decided to say, you know what? She's crying in here. She thinks she might have cervical cancer. You know, she's crying. She's scared. Do you think we could just check inside of her? Or when I told you that the ultrasound technician said there was something blocking the camera, you couldn't help me? You couldn't say, oh, let me look inside her. Why did it take me coming there 3 times, 4 months apart, when I could have easily just died? And even then, the doctor apologizes. Thank you so much, sir. I'm gonna name drop. I don't care anymore because you guys aren't doing anything anymore. You're not doing your jobs. You're not doing what you're paid for. And you should be embarrassed. Very embarrassed. I'm embarrassed for you. When someone comes to you for help, like, I shouldn't have to tell you this. Like, this is crazy that I'm sitting here about to tell you that when somebody comes to you for help, use your brain, your education, your year's worth of education, put your thinking cap on, and get them the help that they need. That's why you're here. It's your job, sorry. I know a lot of you want to say, oh, it's not my job, it's not my problem. No, but actually it is. Do you know the title that you hold? Did you not take a Hippocratic oath? Did you not? Yeah, you did. I'm pretty sure if you have the title doctor or whatever in front of your name, you took an oath, right? Be accountable to it. Do what your job title says for you to do. Be smart. Be smart then. Because I'm sure you love to rub it in people's face that you're a doctor or a nurse. So be competent. So please do exercise your abilities and show off how much you care and want to help and want to take care of people who come to you for help. Show off, please. I want to see it. Because what I've seen has been atrocious. And then on top of it, like, your customer service skills, your client care skills are just questionable. They're very questionable. You guys need some training staff in here to come, like, whip you guys into shape. And no, I don't have any degrees or certificates to be able to tell you that, but I know life experience, gifts and talents that come free of charge have helped me. I know that when you are in a service position, a position of servicing people, you have to actually embody an attitude of servitude. You know that, right? I know it's so hard for you to understand. That's why you took the oath, right? Am I incorrect? Somebody tell me if I'm incorrect. That's why you took the oath, right? To help people, right? If you don't want to help people, get out of the profession. We don't want you here. Go somewhere else. Go do something else with your time. Because it's really giving like 2 stars. It's giving 2 stars. I'll be sure to make my reviews. Because you know I get views on those. I would like people to do better. That's all. I'd like you to do better, especially as a professional. You wanted to go into this. Do better. Just like me as a parent. I chose to be a parent. I love being a parent. It's difficult at times, especially lately, since all the things I've been going through, it's been difficult. But I know what I want for myself, my children, my spouse. And I know that it takes me being healthy. And that's why I'm here, to get help for my issues. But I just want everyone to understand and realize that it doesn't matter what you hold, what type of degree you hold, certificate you hold, education you hold, that doesn't negate you from having issues and or making mistakes. It doesn't, as you can see. Instead of checking me out, the doctor sent me home, put my life at risk with no care in the world. They went home to their family. They probably laughed at me with their colleagues because of the issues that I was facing, unfortunately. They didn't care about me enough. They didn't care about my life. When I was pregnant with my daughter and I'm going into labor and they're telling me, oh, you're not in labor, at both hospitals, at Credit Valley and at Milton. They're gonna tell me, oh, you're not in labor, and then put their fingers up me and see, oh no, the baby's here. Oh, now I'm getting sick and tired of slow. I'm getting sick and tired of people who claim to be smart, who claim to know what they're doing, who are putting our lives in danger, who don't care. They don't care. They don't even care about themselves. They don't. You can tell, because I bet you the doctor didn't think I would go make a video. I bet you the hospital didn't think I'd go make a video. I bet you they're like, oh, such a sweet, nice girl, doesn't need to be here, doesn't need help, just maybe crying for attention. I bet that's what half of you think. But then when something happens, you guys are so confused. What are you confused about? What are you confused about? That someone who's pretty, who's young can have issues? Someone who knows how to speak the English language correctly? Someone who has personable skills? Someone who cares about people can't have issues? If a doctor or a nurse can make such a silly mistake that not even you or I would make, what makes you think that little old me can't need some help? But I love it. It's empowering. It's really, really empowering. It's really empowering because it really just shows me what people think of me and the perception that I give off. Even though I might be struggling, people just think, listen, you okay, girl? So okay, hey, I'll take the compliment. I will. But I'm gonna get what I deserve. I'm gonna get what I need. Just think about it. Like, your wife goes into labor here at the hospital that you work at. Your wife goes into labor, and they tell her when the baby's crowning that she's not in labor. You gonna get upset? You gonna get upset, doctor? You gonna get upset about that? Or not? What if it was you? What if it was your daughter? What if it was your daughter who was having some gynecological
Gynecological.
and she went to the hospital and they sent her home, didn't do their due diligence. She comes back again 2 months later. They sent her home again, didn't do their due diligence, only to find out that there was something inside of her the whole time. They didn't take the due diligence to check her when she was there for 6 hours 2 times, 2 months apart, to make sure that she was safe. Wouldn't you be upset? Wouldn't you be upset about that? I would be. Or when your child goes to the hospital because they're going through a mental health crisis or they need some sort of mental health help. And then the nursing staff and the doctor said, well, doesn't your parent work here? Like, why are you here? You don't need help. Like, they can help you. Go home. Go home. They can help you. Get your doctor father to help you. Go through him. You missed your appointment. Go through him. Because we can't help you anymore. Go through him. Imagine that. Would you be upset? Oh, I'm sure you'd be pulling all the strings. I'm sure you'd be calling up all the lawyers then. I'm sure. Do better. Enough is enough. Do better. I'm trying to do better. I'm trying to do better too. Without your help though. Because you're not very helpful. Bye.